everyone, my name is Teacher Deddy. I'm the co-founder of Kodecoon Academy. And in this series of Let's Chat with Teacher Deddy, I invite my friends from various industries to share with you a bit more on some of the technological changes that are coming in to disrupt the industries and how we can better prepare our students for the change that is coming. Now, today I'm very happy to be accompanied by Dr. Colin. He's actually my secondary school friend in Catholic High before we parted ways when we go into different JC. So now I'd like to invite Dr. Colin to share with us a bit more about his educational background.
Hello, my name is Colin. Glad to know Deddy since 2005 or 6. Yeah, so 4 years through Catholic High. We were even in the same CCA back then, right?
Yes, you were my president of choir.
Yeah, we were quite choir mates. So 4 years together, classmates, choir mates. So we know a long way.
Yeah.
After Cat High, I went to Victoria Junior College. The reason why I go so far was also because I wanted to pursue a little bit more in my CCA, which is still choir. Yeah, back then the choir was pretty good, so I wanted to join them. Then 2 years later, A levels, thankfully did quite well. Then at that point in time, I didn't really think of where I want to go. Didn't really have like a dream, or I want to be a doctor or lawyer. But I probably wanted to do something more medical. So of course, I gave myself a little break. I didn't apply straight away. Only during my army days, then I decided, okay, after talking to different people, then, why not, let's try dentistry.
I see.
Yeah.
But you got your straight A's, right? So there are a lot of doors that can open up.
There are a lot, yeah, thankfully,
right.
thankfully.
But what made the change of you wanting to focus on dentistry?
I think for me, generally, with regards to the reason why I want to join the medical field is because I wanted to help more people. My mom generally takes a lot of different medications and stuff like that. So at the start, maybe I wanted to go into more like a medical field, learn a bit more about medicine, can help her in her daily life, in terms of helping her with medication, some things cannot take, some things can take, that kind. Then after a while talking to different people, then I realized actually the medical field, whether you're a pharmacist, doctors, but they are all very, very high stress level kind of jobs, maybe work-life balance not so great. Then subsequently I met a few dentists back then. Then I realized, hey, dentistry is not just about the science, about the medicine, but also a lot of art in it. Yeah, and like we are arts people, right, since young. So I realized not just about technology, about the doing part, but there are a lot of art to it, how you interpret, how you design smiles, how you get people to, smile confidently due to the shape, the facial profile and everything. So it's a lot more complex, but at the same time, a lot of areas where you can also define yourself.
I see.
Yeah.
So it's not just about science, right? There's a bit of a dexterity and art that you have to bring
that
along.
correct. Yeah.
And so after JC, you went to army, right? After the army, you went to NUS?
Yes, NUS dentistry.
I see. So now, Dr. Colin, now that you have, after you graduated from NUS, you worked for a while before you started your own dental practice?
Yeah, so I have actually worked about 3.5 years in public. Went through the whole COVID period.
Yeah, I remember I visited you too.
Yeah. So I even went through the front lines, doing swabbings for the foreign workers.
And that was during COVID period, right?
Yeah, the peak period. Then after that, came out in private, joined a big chain. Then honed my skills a little bit for about another 2 years-ish. So now I'm out as a new practice owner. So I think I'm about 5 to 6 years out from school.
I see. So now you are also an entrepreneur, right? Because you built up your own clinic.
Yes.
And I heard that it is at Kovan.
Yes.
Yeah. What is the name of the clinic called?
It's called Maple Dental.
Okay.
So our first branch is at Kovan. Hopefully, maybe more to come in future.
I see.
Yeah.
So Dr. Colin, now that you have been in the industry for a while, right? Do you see any technological changes that are coming in? That's already been in place, or are there any significant changes that you see on the horizon?
I would say now the hot topic is about AI, ChatGPT, how all these machine deep learning can help with our own daily life, daily activities. I would say dentistry is similar. Technology have advanced over the past 30, 40 years, where previously people don't even talk about implants, but now implants are like day-to-day things that people are actually thinking about the moment they lose their tooth. I would say in terms of maybe computer technology, we have a lot of area to grow. I know of people who are coming up with AI So they try to gather data, like maybe thousands and thousands of different X-rays, and then they will ask for doctors' feedback, input on their clinical part, and then they consolidate, and then the AI will start to learn, and then eventually, what they want to do is, if there's any patient that comes in with an X-ray, they are able to provide maybe up to 80-90% accuracy of the diagnosis without even the dentist physically check yet. Of course, medicine, dentistry, we always have to correlate. So not just relying on a 2D picture or 3D picture, but you need clinical checking, review, what's the actual clinical features to get the diagnosis. But I think AI, if it develops further, then definitely will give a higher accuracy in terms of the diagnosis. Then you compare with the clinical finding, then maybe the diagnosis accuracy will get even higher.
I see.
Yeah.
Dr. Colin, are there any other examples of technology that have improved your dental care for your patients?
I would say we have a lot of digital scans now. Last time we talked about manual, taking mold, casting the stone cast,
Yes.
and then from there we do our analysis, do wax art, design the teeth individually. Now we have something called digital scan. Of course, digital scan is not something like new within these years. I would say maybe another 10, 20 years ago, digital scans have been coming out, but just not so common. So how the scan works is that they have this machine, an intraoral camera. So they take like thousands of pictures as you scan the teeth, and then they piece them together. They do a rendering, and then after a 3D model will appear. Then
So
from there, they can do like 3D printing, get the model out with very high accuracy. So it actually saves a lot of time in terms of like clinical chair side where the patient have to open mouth a bit longer. They will take the mold not good, have to retake again. But of course, scans is a lot faster. Even if you miss out certain things, you can just do a quick erase and then after that go in, scan again.
So these are 3D scan, right? Not just 2D scan.
Not just 2D scans.
So because we are teaching our students about additive manufacturing as well in our Maker Technopreneurship program, right? So these are real applications of how 3D designs can be used into 3D printing, and then it helps you in your in your care as well. And Dr. Colin, how do you balance between technology, right, that helps you in your work, as well as the traditional techniques that you learn in school and the practice?
Okay, I would say we should never rely technology 100%. Which is why I think it's good that the schools always like to teach us the most basic foundation, how you actually do things like maybe 100 years ago, the techniques that has been used, all the way until present, you can still apply it. Maybe let's just give an example. For example, when we do crowns, you know what crowns are, right? So let's say if the tooth are very broken down, we will do like a capping, like a helmet over, all right, to help patient to function better, can withstand more biting forces, not so easy to crack. So in terms of crown wise, we have to trim the tooth a little bit smaller. Sometimes the gums margins are very high. Then there will be some inaccuracy where we cannot use the digital scan. Yeah, because sometimes maybe too much moisture or like a lot of bleeding. Then when you scan, the scan will have problems. Yeah, cannot capture because they go by light. Yeah, right. So in those cases where you are unable to control the clinical circumstances, then you will have to rely on the old techniques where we use our normal impression, we use the mold taking, because the mold taking is like physical touch. So it actually captures the whole tooth, the surrounding features and everything. Then you take the mold to do your casting to get the stone models. So that's the part where you cannot rely 100% on technology. Of course, maybe the technology has still got room to improve, but you still have to fall back to correct in case clinically something is going out of what you expect. Then you know like, okay, I have all this foundation, I know what the basics are, I can go in straight away and rectify.
I think all these dentistry schools are still important, right? Because we cannot, like you said, we cannot rely 100% on technology, right? Same with ChatGPT, right? We have students who come up with answers with that, right? Or a quick research, but they still have to eyeball it. They still have to look through it.
Based on their knowledge.
Correct, and not just take it as 100%. Now, when it comes to patient, Dr. Colin, have there been pushback on the patients when it comes to technology? Do you have any examples where those patients that you meet, they have concerns around technology that you use?
I would say so far, I think the technology advancement in dentistry has not been really rejected by patients, because it is still like an improvement where patient comfort increased.
Right.
So let's say we talk about scans. People generally don't reject scans because they feel that, hey, at least now I don't have to withstand like this yucky, slimy kind of mold-taking material.
Correct.
You know,
You have to open their
your
mouth for so long.
mouth so long. So I would say I think the very minimal rejections for now.
Okay.
For now, the thing I would maybe foresee, maybe some patients wouldn't like all these AI functions if we were to implement it in the near future. So just a very quick example, because let's say we come up with AI or we come up with robotics where the robot replaces the dentist to do, let's say, implants, to do your crowns.
Yes.
Yeah. So in that sense, I think dentistry is still hard to replace manual hands. People will still feel, hey, it's a robot, it's an AI. They cannot sense my emotions. I have a lot of dental phobia, you know, I'm very scared, I'm very stressed to be on the dental chair. So, but with a human touch, as a dentist, we know how to, you know, calm the patients down, give reassurance, you know, and give proper advice so that they know what to expect, they can calm themselves. But AI, robots, I think there's very minimal changes so far. I don't think they can really detect emotions that well as compared to human touch. So when the treatment actually, you know, proceed on and then you say, no, I want to stop. The robot may not be able to
stop at
stop at where you want to. So I think when the near future comes, when robotics come in, the AI features are all kicking in, then I think people will start to think about, hey, whether do I really want such a technology in dentistry?
I'm sure, especially for the younger children, right? You know, I think going to dentist as a child, you know, back in your childhood, you realize that it strikes fear, right? And it requires a human touch, like you say, right? And the dentist to be able to kind of empathize and make sure that they are comfortable. Right? I'm sure at this point, if you tell me to have a robot dentist, you know, it won't be able to reach to that stage yet. And Dr. Colin, recently in the medical industry, we also see a lot of tele-doctors, right? Do you see there's a possibility, or are there already an existing applications where there is tele-dentists? What are your thoughts on this?
I would say, yes. For telemedicine is up and coming. I think ever since COVID, more and more doctors are going up onto telemedicine, getting themselves certified and do teleconference, like maybe they just have a video of the patient, live video, and then they'll just do consulting over the thing. I would say teledentistry can be done. There are not many people are coming up with it. I'm sure there's an app. I'm just not sure whether has it been implemented in Singapore or not. But definitely there somewhere, maybe US, UK, they do have some teledentistry coming up already. I would say in the local scene, teledentistry can be implemented in the near future, and I think it will probably be a hit. Because if you think about it, maybe you just have a simple question, let's say after a treatment procedure, right? But you don't really want to go down and see the dentist. Maybe it's just like a post-operative kind of review, right? Maybe after wisdom tooth surgery, you are unsure of certain symptoms that you are facing, then you know, oh, very scared, I don't know what's happening. But actually, to us, maybe to the dentist, this is normal, you know, it's a part of healing process. So sometimes you don't really need to go down all the way, take a trip, and then after wait for maybe 15, 20 minutes if the queue is long, and then just to get a 5-minute consult. So I think teledentistry definitely can come into play where we can just do a schedule. Maybe the dentist can be in the clinic, you can be at home, you just give a call, make a quick, 5-minute teleconference, then check in with the doctor. Hey doctor, I'm feeling this, I'm feeling that. What should I do? Then for us, most of the time, even at chair side, what we do is we'll check what are the signs and symptoms, we do clinical features. But maybe the patient can just take a short photo, a snapshot or a short video. Then from there we can roughly gauge what it is. Or if we really can't tell, then we ask them to come down. But if let's say just based on the photo or the short video, then we can roughly tell what's going on based on the symptoms that the patients provide also. Then I think that saves a lot of time. So definitely room to grow in teledentistry.
So teledentistry is not it usually focuses more on the follow-up consultations, right?
Yes,
it doesn't replace the initial going down where the dentist have to check your teeth.
Yes, unfortunately, I don't think let's say our layman
Yeah.
iPhone, Android phones. I mean, in future maybe,
Maybe,
like, they
yeah.
come out with apps where
Yes.
wow, you can really do
Yeah.
your own scans.
Yeah.
I mean, nowadays they do have you know, all the aligner companies, you know, where they do the clear
Yeah.
aligners to
Yeah.
track your teeth,
Yeah.
realign your teeth. Some of them already coming out with like digital kind of analysis,
Okay,
where
okay.
some patients actually just take a photo of themselves,
Oh wow.
just simple photos of their teeth,
Okay.
and then they can roughly gauge how long the treatment will be and
Wow.
everything.
Okay.
Yeah, but of course they will still usually ask the patient, if you want to take this further, you want to do a proper treatment plan, then you still have to visit the dentist, maybe do an analysis itself.
Right.
But people are already coming up with short videos or even snapshots of like just multiple angles, and then they can do analysis already.
Okay.
But of course, like a brief one, detailed still a bit hard.
I see. So, Dr. Colin, I understand that you are also a teacher yourself, right? You're also teaching the younger ones, the juniors. What is, maybe you share with us a bit more? What are some of the things that you teach them?
Okay, so I'm actually a part-time instructor in NUS Faculty of Dentistry.
Okay.
Trying to give back to my mother's school. Yeah, so of course, we go there like on a volunteer basis lah. Yeah, then my job scope currently is to teach the preclinical modules. So that means students from the year 2s converting to year 3. So they are learning the preclinical stuff before they actually enter into clinics. So of course, the things that I teach are mostly lab based stuff. So of course they have they practice on stone models, they do their teeth fixing, wire bending. So more on the lab side.
Right.
Yeah, but that prepares them as a foundation before they actually start to see patients.
Yeah. I'm going to move on to a very, I would say, a bit more sensitive, tough questions, right? Regarding ethical dilemmas, right? Are there any ethical considerations that you see, being put in place in the practice of this dental care?
Ethical dilemma. Okay, I would say that the dilemma that I face most of the time it's from the patient management. So we do have a lot of patients, definitely they don't know in depth about dentistry, they don't know how treatment planning works. They just have a problem and they want to solve the problem. And sometimes, unfortunately, those problems, we don't have a good solution to it. Right? Let's say the tooth is failing. There's no, in our day and age, we don't have a good enough solution to it. We can't save that tooth anymore. But the patient is like, doctor, I really can't pick up my tooth, due to whatever reason. They just want to keep it, even though maybe it's like really shaky, you can just pluck it out yourself kind. So that kind of dilemma is where, as a doctor, am I supposed to give a compromised treatment? Okay. Because I know that if, let's say, that tooth is failing, there's an infection coming about, the patient doesn't want to remove. But if I don't encourage them to remove, things may snowball, it may affect other things. But at the same time, I need to respect the patient's decision. Yeah.
Because it's their tooth.
Correct. So maybe the patient say, doctor, it's okay. I'm willing to pay you this amount, X amount. You just do whatever you can. Just save this tooth. Okay. Then in my mind, it's like, I can earn the money, right? I can earn the money. But I know that this treatment's not going to work. Should I still go ahead to provide this treatment that I know is not going to work, just to make the money? Right. So this dilemma is difficult. So I always tread it very carefully. I always tell the patient, I say, look, I don't want you to waste money. When you are saving a failing tooth, essentially, I can only make it last maybe a few more months. Right. Do you really think that it's worth to pay that that X amount to keep this tooth maybe a few more months? I see. If you are willing to bear the risk and consent, everything done, then okay, I will proceed. But at the back of my mind, there will always be this, like you said, dilemma, whether you know that it's compromised treatment. Do you really want to do that? Because at the end of the day, if let's say patient, say, can tell you all the world, say, doctor, it's okay, I take responsibility, but you never know after the treatment, somehow there's a complication, even though you warn them already. Patients can still put the blame because they're not professional. Patient will still say, doctor, if you have known, you still should not have done. Or maybe the patient don't really want to sue me or complain about me, but maybe because of the complication, the family members say, hey, how can you do this? You already know that's going to fail. Why are you making my my family friends who
Yeah.
pay this money,
Yeah.
this amount of money to just treat the tooth like this.
I see.
Then eventually when you go to the professional board will be like, actually, you know, this treatment plan is wrong. Why are you doing this?
Right.
So there's always this dilemma. So of course there will be cases where I will have to tell the patient, I'm sorry.
Yeah.
You know, based on my code of ethics,
Yeah.
this is a wrong treatment to do. I will not do it.
I see.
So, but at the same time, you may, you know, the patient will be like, hey, this doctor no good.
Right.
Cannot do what I want.
Yes.
So every day is a struggle.
It's a struggle, yeah.
It's a
It's not
struggle.
easy because they have their own thoughts and perspective,
Yes.
and they might not be medically trained, but they think that this is the right way.
Yes.
At the same time, you have your code of conduct and your best practices that you want to put in place.
Yes, correct.
Wow.
Yeah. So it's difficult. But of course, I would say I think 90% of the time patients are still very understanding. So as long as you
accommodating.
so as long as you explain nicely, you tell them all the foundation, all the theory behind your decision, your plan that you give to them. I think most of them they will. But of course nowadays we have Google, Facebook. Unfortunately, people are relying on those advices or comments given by other people who may not be a professional, and then they'll be like, doctor, so and so say this, so and so experienced this, and then they'll be like, how come you cannot do, or like how come they can do, you know? Yeah, so it's difficult.
It's difficult. It's but I think what you mentioned just now, you know, open communication with them, right? It still works.
Yeah.
And I think I just wanted to wrap it up a bit with going back to our students as well.
Right.
Now a lot of them are learning coding at this point, right? At a very young age, as young as 7, 8 years old, they're starting to learn drag and drop programming.
Wow.
They're starting to learn Python and machine learning as well, which is part of AI.
At such a young age.
At such a young age, yeah. So Dr. Colin, how do you think, what are some of the tips that you may want to share with these students who might potentially want to go into your industry?
Okay, I would say it's great for them to start off at such a young age to learn about coding, because we know that technology is the future. So with all this coding knowledge, the background, be it whether they really want to pursue dentistry or not, definitely will help in their general learning and their part of their skill set in future. If relating to dentistry, of course, I do hope that your students in future, all of them can grow up and do well. And then if they were to choose dentistry as a profession, dentistry, I would say there's still a lot of room to grow in terms of the technological part. Let's say we are looking at digital scans, 3D printing, 3D scanning, there's still room to grow from there. So with coding knowledge, and then you graduate as a dentist, that I do know of people who eventually they may not even practice. They actually go into R&D, research, development. We have a lot of dental companies. Maybe we talk about implant companies, we talk about X-ray companies. They are actually hiring dentists who eventually decide, I don't really want to do clinical work, but I have this passion in dentistry. Then with all this knowledge that they have and the coding foundation, they can go in, do R&D with the technicians, with the maybe people with the IT expertise, and then they come up with formulas, they come up with newer apps, better technology to help with our treatment planning, diagnosis, and even the procedures themselves. Yeah. So how all this technology improve over these past 10 to 20 years, right? There are actually dentists who are in those IT companies, software companies, dental supplies that help to give the dental professional aspect, plus with maybe a bit of their coding foundation or even some of their tech background, Yeah. So I know that a lot of dentists actually, we don't just study. We have a lot of other hobbies, and some hobbies or even like some of the skills that they do, right, could eventually help them in the overall profession.
I see.
Right? If let's say you like to invest in technology, you learn a lot about it. Then at the same time, you are a dentist. So in a sense, some things will come to mind. Then maybe like, oh, hey, why not I do a startup? Let's try to solve this dental problem. Right? So I would say even for aligners, people talk about a problem. Hey, I want to fix my teeth, but it's only wires. So eventually, people talk about how about clear retainers, right? How about clear retainers? Then from there, if you have tech background, maybe you can come up with coding. You can design a system where you can analyze and then create a clear aligners to reset your teeth. So I'm pretty sure that's how it came about. Of course,
Right.
the details, the history,
Yeah.
some of them actually, they're not even dentists, but they have all this knowledge. Yeah. So after that, they partner with dentists and then they grow a new product. Yeah, they grow a new product. It could be something physical, it could be a software.
Right.
So I'm
it's
sure
going to be a blend of physical as well as software.
Definitely.
Wow.
So I would say if you have coding background, if you have some tech background, as you grow older, all these skill set will kick in.
Right.
Yeah. Whether how much relevance, definitely depends on what kind of profession you're in.
Yeah.
If you're in dentistry, if you are going to do clinical work, maybe not so much.
Yeah.
But at least when you learn new things with this background, it does help you to learn a bit better.
Correct.
But if let's say you don't want to go into the clinical part, you want to do the non-clinical work, then I would say there are a lot of relevance because definitely everything is going to go digital already.
Okay. And Dr. Colin, maybe just one last question, especially for the parents out there, right? We know there are a lot of students who grow up wanting to help others, and they look at the medical industry. Yeah, there are always these two paths of being a doctor versus being a dentist, right? If we have parents out there who are questioning, which path or what type or at which juncture should my child choose whether should they go into medicine or should they go into dentistry? What would be your advice for this kind of students? I know it would depend on the personality of the child, right? But what type would suit dentistry and what type would suit the medicine?
Very tricky question. Yeah, I would say I have come across these questions many times, especially when we have interns, trying to learn more about dentistry or medicine before they actually apply. So during the break, like after JC, before the uni applications. So I meet a number of interns. Of course, this question will always come up. Say, hey, doctor, whether I should choose medicine or I should choose dentistry or like which one do you think is better? So maybe just a shout out to the parents. I believe that whatever profession that they do, I hope that is because of their interest and passion, but and don't rely too much on the money or the prestige because that won't bring us far. That won't bring us far. Yeah. So firstly, we will need to know whether the kid has strong interest in medical field first. Because medical field, the moment you join, I would say it's a lifelong learning process.
It is.
Things keep changing. You have to keep on learning to catch up with all this medical advancement. And it's a long way. So if let's say you are just relying on money, prestige, I don't think it will last. All right. So the passion must be there. If let's say, oh, I hate blood, I really don't want to touch blood, or even be remotely close to them. Then if they have those phobia, right? Then don't push. Yeah. So apart that aside, then I would say the difference between medicine and dentistry in terms of looking at how personality or character, which one suits better. I would say dentistry has a lot of manual work. But if you're somebody who likes to do manual work and you can see tangible results. Because a lot of times medicine is more about like knowing the person signs and symptoms. You give your medical expertise, advices, you give medicine. The signs and symptoms can only be relieved maybe after you take the medicine, right? You need a process, a time, right? Or even like emergency, patients who are dying, then you do something, then maybe after a few minutes, you will be able to see the results, right? But dentistry a lot of times is like at the moment, something that you do, you get tangible results straight away, right? Let's say you got a hole, I replenish the hole. Within that 5-10 minutes, patients see the results. I'm like, wow, I'm glad that something can be fixed on the spot, correct? So if you're somebody who likes to see tangible results, who likes to work with their hands, then I would say dentistry is the path to go. Of course, medicine, we also can say, you can be a surgeon, you can do a lot of hands also. I would say it's just a different kind of feeling, because medicine, you're dealing with life and death. So when you're at the surgeon level, one wrong mistake, it's really life and death.
Correct.
I would say dentistry, although we cannot make mistakes because it's a very small area, like you just move 1 mm off, you already trim the other tooth, So mistakes can't be done as well. Same high level of stress, but you know that it's a different thing. It's not a life and death. So different kind of stress. I would say medicine, if you are the kind of person that that I don't mind, learning more and more. It's lifelong learning, keep improving yourself. Then if you join medicine,
Yeah.
as compared to dentistry, there's a lot of things to keep learning.
I see.
Dentistry sometimes after a while, I mean, just my own opinion, sometimes it stops somewhere. It stops somewhere. So whatever you learn in school, the 4 years, 5 years, you can still rely on those 4-5 years of what you learn and carry on maybe the next 10 to 15 years of work.
I see.
Yeah, because technology can only improve that much. A lot of things are still manual dexterity. And this, I would say, in the near future is irreplaceable still.
Okay.
Yeah.
Right.
Maybe people can come up something robot arms or whatever, but there's still this guy behind holding the remote control. Yeah. So we will not be totally replaced. Not anytime soon. Maybe, I don't know what, 20, 50 years later, much later. Yeah.
Thank you so much, Dr. Colin. Very, very well said. I think I also learned a lot from you today.
Hey, thanks. No worries.
And I think that I just want to do a shout out as well for Dr. Colin. I think he has been a friend of mine, a very close friend of mine as well. Right. So I do want to do a shout out for his dental clinic, right? Which is located at Kodecoon. Right. We are hoping to work something for our Kodecoon students as well, and for parents here. Thank you so much for staying tuned. Right. We are going to move on to a lot of other stories where I'm going to invite other friends from other industries as well to share with you a bit more live, right? What are some of the technological changes that are coming in to disrupt their industries? And what's most important is that we want to prepare our students early for all these changes.